and do some basic housekeeping. So if you, we would love to hear who you are, and we would love to know where you are from. If you want to enter into the chat box what state or organization you're from, that will be helpful to us so that we know who we're speaking to. We plan time for a Q&A session at the end of the webinar. We would love to hear from you at any time during the webinar. We have somebody who will be monitoring questions and fielding them to our panelists. So I think that's all of the housekeeping that we have at this time. I'm going to introduce our facilitator, Jennifer Pokempner. Jennifer works at the Juvenile Law Center, and she's the director of the Child Welfare Policy at the Juvenile Law Center, and she'll be facilitating our discussion today. Jennifer?
Great. Thanks so much, Shannon. And thanks to everyone for joining today. We are really excited to kick off this campaign and have so many people joining with us. As Shannon said, this is a kickoff for an exciting campaign that we hope you all will join, the Healthcare for Former Foster Youth campaign. As all of you know, the transition to adulthood is a really exciting time, but also a really challenging time for young people. And it can be especially challenging for youth leaving the foster care system who may not have the support of family or social supports that are so crucial to a successful transition. Being healthy and having health care is essential to a successful transition to adulthood. And luckily, we are at a time where society and our laws really have come to recognize this. Under the Affordable Care Act, youth who are connected with family are able to remain on their parents' insurance until age 26. And similarly, youth who are in the foster care system and eligible for Medicaid at 18 are categorically eligible for Medicaid until age 26, regardless of income. This really wonderful provision of the Affordable Care Act really seeks to ensure that all youth leaving the foster care system have health insurance they can rely on and access to care that will allow them to flourish in the adult world. Since January 1st of 2014, when the law became effective, there has been a lot of progress to make this a reality for young people. And many young people we know have seen the benefits in their ability to access needed care and be able to focus on career, school, and family and not be fearful of not being insured. But as most of you on the call know, there's still a lot of work to be done to ensure that all youth are covered and have consistent and continuous access to health care. And that's what this campaign is about. This campaign seeks to enlist youth, alumni, and stakeholders and advocates to deliver on the promise of health insurance and health care for all former foster youth at least until age 26, so they have a healthy foundation for adulthood. In this first of a series of webinars that the campaign will host, we plan to give you an introduction to the campaign goals and the issues, as well as the way we hope to do the work, which is to do it collaboratively. We have a really great lineup of speakers today. Our speakers include Cody Rivera, Celeste Bodner, Sari Helvey, Carrie Van Dyke, and Congresswoman Karen Bass. I'll do a brief intro before they speak, but ask you to review their bios, which are on the slides, because they have a wealth of expertise. We're going to start with a young person's perspective and are grateful to FosterClub and many of you who are on the call who are making sure youth and alumni will be the focus of this campaign and essential partners in this campaign. We'll then get an overview of the campaign, and then we'll hear from two state advocates and a leader in the state in administering the provision. And then we will hear from federal leaders on some of the reforms that are happening at the federal level. We really seek to work with an array of partners, youth advocates, state Medicaid and child welfare administrators at multiple levels, and hope this webinar will kick off both showing how we want to do that and with enlisting you all as support. Our first speaker is Cody Rivera. Cody Rivera is a young leader and former FosterClub All-Star. Cody spent 13 years in New York's foster care system. He graduated from Hobart and William Smith College with a Bachelor's of Art degree in architecture and works at the Bank of America Merrill Lynch. He is also an aspiring entrepreneur and is going to speak to us today about his experience in accessing healthcare. Cody, I'm turning it over to you.
All right. Thank you very much, Jennifer, for the introduction. Thank you, everyone, for being a part of this campaign launch. Especially thank you to Celeste and FosterClub for organizing this campaign and the campaign launch. And thank you to Representative Bass, who I know will be here at the end of the call. I was asked to share my experiences because as a foster youth in 2016, I needed surgery. And I wanted to have my surgery near my foster family who had just relocated to Texas. But because Texas wouldn't insure me under the Medicaid to 26 provisions, I had to face surgery alone and ultimately jeopardize more than just my health, but my success in transitioning out of foster care, as Jennifer spoke about, that success of transitioning out. So my message to you all today before I share my experience is this. The misinterpretation of the Medicaid to 26 provision by the 38 states has a much larger, a much bigger impact on former foster youth than just receiving healthcare coverage. It impacts education, career opportunities, and permanency, all important life experiences and support systems that foster youth need in order to successfully transition out of foster care and thereafter. It affects whether or not youth decide to apply to certain colleges, apply to certain financial aid programs, grants, scholarships, or any other educational opportunity. It really affects the decision in going to different types of careers, taking advantage of career and development opportunities, jobs, internships, job shadows, study abroad opportunities, and a more pressing issue currently in child welfare, which is permanency. I mean, it literally directly affects whether or not a former foster youth could reconnect with kinship care or family, brothers, sisters, aunts, uncles, grandmas, and grandpas, all because of the provision. And again, these are all key life experiences and support systems for youth to be successful after foster care. I recently spoke at a panel at the Onondaga County Permanency Summit in New York, and I was asked to define permanency. And before immediately defining it, I automatically asked, why was permanency important? And ultimately, I came to the conclusion that it was because of it was a support system. But what I did was, when looking at the Affordable Care Act and the new bill, the HR 4998 bill, I asked why that was valuable to youth. Why was it important to youth? And ultimately, that answer was because it supported youth in their transition out of foster care through healthcare. And that's why the Affordable Care Act and the Medicaid to 26 provision was implemented in the first place, to ensure youth were supported in their transition out of foster care. And what's important to recognize is that the misinterpretation of this provision is not supporting that youth or not supporting all youth. So back in 2016, the end of March, I was a foster youth and I was in my junior year of college. It was the first game of the club lacrosse season. We were playing University of Rochester and Syracuse University's club team. And literally the first minute of the game, second pass of the game, I went to go take a step off my defender and completely blew my knee out, tore my ACL, tore my meniscus, and sprained my MCL. But the solution seemed simple at first. The solution was to have surgery, but I had to keep three things in mind. I had to keep my finals, which were coming up soon in May, for a month and a half. I had to keep in mind my internship that I was receiving through FosterClub, and then my living situation. At first, I decided to have surgery in Geneva, where my school is located, because that's where my doctor was. And then I ultimately made the decision to have my surgery after finals because I didn't want to be interrupted or unfocused from the pain and the rehab. As well, it was important to have that month rehab before surgery anyway for a better recovery. But then I had to keep in mind my FosterClub internship, which I received at that time, and I was ultimately choosing to do session A, which is an earlier session of the internship, but I ultimately decided to do session B, so it was not a big deal. But then that adjusted my living situation. Now, because I was going to have to wait 2 months after school to enter the internship, I had to figure out where I was going to live, and I ultimately decided to move to Texas with my foster family. Now, my plans were set until I spoke to my doctor. And this was the first time ever dealing with an injury like this. But when I told my doctor my plan, my doctor automatically said I couldn't have surgery in Texas or he wouldn't perform surgery on me because he needed to do daily checkup appointments after. So I had to meet with him constantly. So again, I said, you know what, that's an easy solution. Let me just have surgery in Texas. Ultimately, that did not work out, because Texas couldn't insure me under the Medicaid to 26 provision. Now, at that time, I thought about switching my foster care status from New York to Texas, but that was quickly shut down because I could have jeopardized all my financial aid, all my grants, all my scholarships through New York State, which paid for my $68,000 a year tuition, a very expensive tuition. And I came out of college only owing $2,500. But if I would have switched my foster care status to Texas and received the Texas Medicaid or Medicaid in Texas, I could have ultimately owed $70,000 at the end of my college career versus $2,500. And ultimately, as a result of that decision, I wasn't able to see my foster family for another year and a half. Now, the next option was to go back to Staten Island, where I'm originally from, and go to a foster home there. But I did the cost of traveling to and from physical therapy 3 times a week, back and forth to and from work. And ultimately, it was too expensive, too time-consuming, and too much of a physical barrier. Plus, I had a dog, and no foster parent was willing to take me into their home with a dog. So ultimately, the way Texas interpreted that provision had an effect even on the services provided by my foster care agencies. So now I was ultimately left with one of my last options, which was staying at school on campus. However, that came with huge financial implications and burdens as well. How would I pay for all my living expenses, toiletries, food, housing, phone, credit card, dog bill, etc.? So I spent the time figuring out the math, calculating my living expenses, even the taxi to and from physical therapy 3 times a week, to and from work if I were to find a job. And I literally couldn't afford it. It almost added up to $4,000 just for 2 months with all the living expenses included. Now, I'd been saving money since my second semester sophomore year. I'd been receiving additional scholarship money continuously from all the aid in New York State that was offered, which was great. But I used those funds for 2 reasons. One, to pay for my expenses throughout my semester, so I wouldn't have to work, because I was an architecture major, so it was very time consuming, and I didn't want to be unfocused from my work. So I used that to cover all my bills. And then the second was I had a saving plan for after college. It was a saving plan so I could successfully transition out of foster care. So I could get an apartment, get a car, live in Geneva, which I knew I was going to do because I was going to start an industrial hemp business with my business partner. So I wasn't willing to take that money out of my savings account because I needed to still think about the future and successfully transition out of foster care. Now, the challenge that I was faced with in terms of living in Geneva and staying at Hobart is that I needed to find a job to accommodate my physical therapy schedule and my income needs to support all those living expenses. It was ultimately already too late to apply for a lot of internships with the different departments on campus, but it didn't stop me. I mean, I stopped at every department on campus: Centennial Center for Leadership, Center for Community Engagement, Intercultural Affairs Office, HOP Office, Study Abroad, both Hobart and William Smith Dean's Office, President's Office, Conference and Events, and even though, and ultimately I didn't get a job with them at first. But then even those places and departments and professors recommended me to jobs outside of campus in the community. And ultimately, because of the physical barrier, I couldn't work and the time commitment that I had to physical therapy. On top of finding the job, what I decided to do was I decided to actually appeal my housing costs, my summer housing costs at Hobart. I ultimately met with the directors of residential education, the deans, conference and events who dealt with summer housing, and I ultimately won my appeal through the support of those departments and cut that cost by I think maybe $1,500 to $1,600. But then I just received also a part-time job with the Intercultural Affairs House, which also cut some costs and brought in some income, and also cut some food costs because the director was willing to help me with meal tickets on campus. So I received a lot of support. I even applied to an emergency fund and received financial support through ACS, which is for New York City. And in regards to the transportation costs, the way I cut that was ultimately campus safety was generous enough to offer me transportation rides for physical therapy, work, food shopping, things like that. But then the last problem I faced was the physical and emotional support that I had to deal with in terms of living up at Hobart. But ultimately, I had a bunch of friends that were staying on campus doing summer research that were able to help me, cook, help me with taking care of my dog in terms of walking her and things like that. So ultimately, I had to go through all these different decision making processes, and I ultimately cut my costs down to from $4,000 to a few $100s, including the physical and emotional support that I received. And ultimately, I'm not mad at the whole situation. Having gone through all those steps, I learned a lot in the process. I learned to manage a lot of challenges and barriers that came up. And ultimately, I even used the whole process that I went through and the barriers that I went through with the Medicaid supervision to ultimately show how I persevered. I used it in my job interviews, in other interviews for internships and things like that. So it was ultimately beneficial. But I think about very vulnerable youth who don't have the skills or don't have the opportunities or the resources like me, and the predicament they would have been put in. I really would have never guessed that this provision, this misinterpretation, this loophole could have affected so much more than just healthcare. I mean, it affected my educational decision, my finances, my career development decisions, and my family decisions. I not only risk losing my healthcare, but I also risk losing the hard work and progress towards earning my degree and successfully transitioning out of foster care. Now, life challenges and tests the strongest people, and the Affordable Care Act and the Medicaid 26 provision does just that. But how does it challenge the most vulnerable youth? What would it do to the most vulnerable youth? I think that's a bigger question. In all honesty, if I didn't receive the support I did from the HWS community, I would have ultimately chosen my last option, which would have been 2.5 months of homelessness and the risk of never playing sports again by staying in Geneva, just so I could receive my degree. I worked too hard, far too long to let Texas or any provision to affect not receiving my degree. I made too many promises to myself, my sisters, my friends, my families, my mother, and my foster family that I would receive that degree, and nothing was going to stop that. So really, so let's not force anyone in this situation, especially the most vulnerable youth and young adults. Let's recognize that the healthcare coverage provision, the Medicaid 26 provision, is not the only support system being impacted, but other support systems that affect the success of foster youth, because that's ultimately the goal and value that is brought to youth by the Affordable Care Act. So let's get this campaign going. Let's get this HR 4998 bill passed. And remember, that's not just healthcare coverage. So thank you very much, guys.
Great. Thanks so much, Cody. We appreciate hearing from you. And I think it's a really important point that we're talking about healthcare, but we're also wanting to understand the impact that making all these hard choices and not having access to healthcare, how it impacts all areas of your life. So thanks so much.
Absolutely. Thank you very much, Jennifer.
Thanks, Cody. Now we're going to turn it over to Celeste Bodner. Celeste is the founder and executive director at FosterClub. Celeste believes in FosterClub was founded on the principle that self-advocacy, access to information, and youth involvement are key to well-being and resilience for youth in care. Celeste is an expert in many, many areas of the child welfare system and youth advocacy. She's a foster parent and has received multiple honors for her child welfare and advocacy work. I'm going to turn over to you, Celeste, to tell us about the campaign.
Thanks, Jenny. So, boy, Cody, you couldn't have made a more profound sort of case. I'm sure I'm not the only person on the line that in hearing your story, you just make a case about why a campaign like Healthcare for Former Foster Youth is so important. FosterClub has recognized and been involved with many partners in trying to forward implementation of the ACA provision for several years. But what we found is that there's some disjointedness and that many states are finding it confusing to figure out how to do the best implementation in their own jurisdictions. So not only has the provision been a little confusing for young people trying to navigate their way to healthcare, it's been confusing for state stakeholders who are committed to foster youth and want to make this work and make best use of this opportunity, but it's been difficult. And so really this campaign came together when FosterClub worked with Jenny Kempner at Juvenile Law Center and Spark with First Focus, and also through some work that we did with Children Now in California. And we received a grant that allowed us to pull a campaign together. And the idea of the campaign is really to become a clearinghouse and a convener of state stakeholders so that we can learn from each other and start to shape best practices and inform better implementation of healthcare for former foster youth. Some of the activities that we've done to start with is we've done a campaign survey of states and where we're asking several questions to get an idea about where states sit in their implementation process. And during that time, we were able to identify many implementation challenges that seem to sort of run across the board for several states. And Sarah is going to cover these further as we move along in the presentation, but I'll just list what they are. The first area that we found that states are having problems with is the one that Cody illustrated, which is coverage for relocators. What do we do with young people who are moving into a state where the state is not opting to cover youth who are moving from out of state? Next is the idea of seamless or auto enrollment, specifically when young people age out of foster care, what the enrollment process looks like. Next is for states where we have an application process for former foster youth, how do we make that a youth-friendly application process, and how do we make it so that young people who are former foster youth aren't having to complete 30-page applications asking for data, frankly, that many of them don't have access to. Another piece that we identified as a challenge was the automatic renewal each year. As young people move through the transition to adulthood, we know that often they're moving and not necessarily in the same address. And also that it's just difficult to track sort of an automatic renewal. I mean, sorry, if they have to submit renewal, that can be tough to track. We're also finding that many states aren't tracking data and aren't very clear about how many young people are enrolling through the former foster youth provision. Next, we know that some states are having difficulty with youth outreach, particularly for older youth who've already left care. It can be tough to track them down and to ensure that they know that this benefit is available to them. And then finally, there's the new requirement or the state option to have that requires Medicaid recipients to work. We know that can be a challenge for young people. Again, Cody's story illustrates how hard he is working to obtain his degree, and the work requirement for Medicaid recipients could be a huge burden on young people transitioning out of foster care. So during the campaign, really the campaign was designed to be able to be of assistance to state stakeholders. So during the campaign, we will be providing technical assistance, and that will look like webinars such as this. This is our kickoff webinar, but we'll actually have webinars for each of the 7 focus areas and possibly more if more focus areas emerge. We'll also be producing white papers and a communication toolkit and other tools to help states with implementation. We will have a central youth outreach landing page where young people can learn more about the benefit and how to apply, and it will help navigate them through them. I'm sure you all were impressed with how tenacious Cody was in figuring out what was going on, but we know that not all young people will be that resourceful, and so having sort of a one-stop place where they can find information about accessing healthcare is important. And then finally, we will be doing work to educate policymakers so that policymakers who care about our young people in foster care have the information they need to help us improve implementation. Next, I think I am turning it back to you, Jenny. Or perhaps I am just leading with an introduction to Sarah Helvey of Nebraska Appleseed, who is going to give us an advocate's perspective.
I'm so sorry, Celeste. I'm sorry to everyone. I put you on mute. I introduced Sarah to myself. Sorry, everyone, and sorry, Sarah. Sarah Helvey Sarah's a staff attorney and director of child welfare policy at Nebraska Appleseed. Sarah is a state and national expert on many issues related to child welfare and juvenile justice. For example, she's worked closely with Project Everlast, a youth advocacy group of current and former foster youth, to pass and implement a law that created extended foster care in Nebraska. She also co-chairs the Strengthening Families Task Force under the Nebraska Children's Commission and serves as a co-chair of the Medicaid to 26 work group of SPARK. Sarah, we'd love to hear from you of the work you're doing in Nebraska.
Great. Can you hear me okay, Jenny?
Yes.
Okay, great. So thanks so much. I'm really honored to be participating in this webinar today and really excited about this campaign launch today. I do have to tell you all that I'm presenting this webinar from home today because of logistics. I couldn't be in my office. And I have an 8-week-old bulldog puppy. So I hope that he behaves, but if you hear tiny barks, you will know that that's why. You probably all wish that I was using my webcam today, but I can assure you he is just as cute as you are imagining in your mind. So again, hopefully he behaves. My job today is to talk about the 4 focus areas that Celeste mentioned and just kind of give an overview. As a state-based advocate, these are all things that I've seen in Nebraska, and I know these are things that came up we identified them as focus areas because of what we heard from state advocates through our state-by-state network, and also FosterClub's experience with the youth advocates across the state, and also reaching out to many states to identify these issues. So I'm just going to run through them kind of quickly. The first one we call coverage for relocators, and this is the issue that Cody was talking about. And I can't really say it much better than he did, but just to give a little bit of overview of it technically, this is what we used to call the state option, but the federal government released regulations in the fall of 2016 that states must apply for a federal 1115 waiver to provide coverage for youth who age out of foster care and then relocate to another state. And I think currently only about 14 states have applied for that waiver to serve out-of-state youth. So we think this is really important because of all the things that Cody said. Gives young people an opportunity to relocate for that support that Cody talked about, for a job, for education, for surgery, whatever it may be. And so it really is important that that issue is addressed. And so we're really thankful to Representative Karen Beth, who we'll hopefully hear from later in the webinar about HR 4998, which would make that coverage part of the mandatory eligibility category. The second focus area that we've identified as part of the campaign is seamless or automatic enrollment. So most young people are covered by Medicaid while they're in foster care as a minor. And then when they age out, they should not be terminated from Medicaid until the state has identified that they're no longer eligible. And in most cases, the state has all the information necessary to determine eligibility coverage, like they have the young person's date of birth, they know their foster care status. And so really we think it's required by federal law, but also urging advocacy to make sure that that's happening, that young people are seamlessly transitioned from Medicaid coverage when they're as a minor to the Medicaid 26 category as they age out of foster care. The third focus area is a streamlined application. As Celeste mentioned that also in terms of just not overcomplicating the Medicaid application. There's additional information that's required for other categories of Medicaid, but this category is pretty simple. And as I said, a lot of the information is already in the possession of the state. And so we've seen some states like California, for example, have a one-page application for this category. And so it's really important that we don't create additional barriers to enrollment for young people who don't enter into this category directly from when they age out. The next one is automatic renewal of coverage until age 26. And so that is, some states do for a re-enrollment review. And it's important that because in this particular category, a lot of the eligibility is pretty stable. Because it's age, foster care status, those things don't tend to change. And so what we're urging is that the young people are able to stay on this category until the state receives information telling them that a young person is not eligible. For instance, they're receiving aid in another state, or they get some information prompting a question about state residency. And so again, maintaining that coverage unless there's information to the contrary. I know of one state, we have a Spark partner where the state does a really good job of enrolling people automatically as they age out. But then a year later, when they do renewal, they see a lot of people dropping off at that time. So this can be a really important aspect. And the next one is data tracking. This one Nebraska really struggles on. It's important that states are keeping track of how many young people are successfully enrolled in the category and ways to identify and target eligible youth who are not covered. And then youth outreach. States can do this in a number of ways to reach young people who are leaving the foster care system so that they're aware of the coverage and how to maintain it. And so I think this campaign will have a lot of tools to help you and your state to increase outreach to young people so they know that this is available to them. And then next, as Celeste said, the Center for Medicare and Medicaid Services, CMS, provides states the option to impose work requirements on Medicaid recipients, again, through 1115 waivers. And we just think it's really important as part of this campaign that there is an exclusion for former foster youth for states that do impose. We hope the states don't impose work requirements on Medicaid, but if they do, that there is an exclusion for former foster youth. And, part of the intent of this provision is to have former foster youth on par with their same age peers who are able to remain on their parents' private insurance until age 26, regardless of whether they're working or not. And so that aspect is consistent with the original intent of this provision. So with that, I'll turn it back over to Jenny and the rest of the presenters. I'm happy to answer any questions if we have time at the end. Thank you.
Great. Thanks so much, Sarah. And we want to remind everyone to chat in questions if you have them during the webinar, so that we're aiming to get to them by the end of the session. Now thanks so much, Sarah. We really want to start to hear more from states, and we're going to, in one moment, pass it to Carrie Van Dyke, who is Department of Human Services Child Welfare Youth Transition Specialist in the Independent Living Program for the state of Oregon. Carrie has worked for the state of Oregon for over 21 years in a variety of capacities serving children and families. Carrie is an innovative leader and expert in the area of transition age youth and has been on the forefront of child welfare reform in Oregon and has really worked closely with youth. And one of the focus areas that she's been working on, including the Medicaid to 26, is also a Children's Foster Care Bill of Rights and a Sibling Bill of Rights. Carrie, can you tell us a little bit about the work you're doing in Oregon?
Sure. Thank you so much, Jenny. Right now, we are also looking at this issue and really want to thank you for your time and your interest in this topic, because it's something that affects a lot of young people. And so I'm really excited to be a part of this webinar and really want to talk with you today a little bit about kind of what Oregon is facing and some of the challenges and things that Oregon is seeing, as well as some of the resources that we have, and then kind of what we would love to see with this campaign. So really just want to, kind of echo what Cody and Jenny and Celeste and Sarah have really talked about, which is that our foster youth are categorically eligible and entitled to be covered until age 26 through the Affordable Care Act. But yet there's so many hoops that foster youth have to actually go through, including the application process, which can make it a very challenging obstacle for our foster youth to get and keep medical coverage. So currently in Oregon right now, because of rule changes that happened in 2015, the application is 28 pages long. And so, as you might imagine, if we even had to fill out a 28-page application, that's a pretty daunting process. But the reason why they went to that kind of format is because they have to go through that in order to see if the participants are eligible for other programs first, and then the backup, or the kind of the fallback, is the Oregon Health Plan. So as part of that process, then they have to go through this 28 pages to determine whether or not they qualify for any other program. And if they don't, then of course, then they're eligible for the Oregon Health Plan. However, as part of the application process, the form does ask former foster youth for income verification. So, what Celeste talked about, and Jenny and Sarah, is that coverage is available to these young people regardless of income. But that can also be a very daunting and overwhelming process and question. And oftentimes with our young people, that can be pretty stressful and, as I said, overwhelming. And so sometimes they don't go to finish that application with that. In addition, in 2015, we used to actually, before then, have on-site helpers in DHS who actually used to contact our young people, and they would actually go through the application with them on the phone, or, through email. And now we actually have them go through customer service at the Oregon Health Authority. So one of the issues that we've run into is that some of the representatives are more knowledgeable about the former foster care youth medical program, specifically for our former foster youth, than others. And so sometimes they get inconsistency of information or incorrect information because the representatives are not as knowledgeable with that. We've also found that there is a lack of communication between agencies, and then we we have the issue of staff turnover. So that might be within DHS child welfare itself, or it could be with the independent living program providers who assist our young people sometimes with helping them get the health care, or it could also be, like I said, the representatives through the Oregon Health Authority that might, the expertise and the knowledge of the program can vary with that. So we do have renewal applications, and luckily they are much shorter. They're only about 5 pages, but the problem is that you have to reapply every year. So the renewal packet is actually sent to the last known address, and if that address is not current, then the packet is returned, and Oregon Health Plan will actually close the eligibility, and then that young person will no longer have health coverage, and they actually have to reapply. So as you might imagine, that can be quite an obstacle and barrier as well. The good news is that we do have some resources available to us here in Oregon, and one of those is being able to refer people to what we call a trained application assister at FosterClub, who actually walks them through that process, can go through the application with them, and be able to explain and finish that application with that young person. However, not everybody is aware of these types of resources, and we also run into the situation where our young people are not always aware that they are eligible for Medicaid until age 26 through the former foster care youth medical. So a national campaign would really be beneficial. And I think particularly in the areas of helping with, assisting with education, the coordination and simplification of the process for foster youth, who again are categorically eligible to receive health care. It would provide some consistency and networking between states, so we could actually see what and how other states are doing this. We would have better youth outreach, so we would actually have more young people more aware that they are eligible for Medicaid, and to have technical assistance and supports for states, and I think also making sure that we have accurate information and information that people can go to in a central location. So we wouldn't also be bouncing around between agencies or multiple systems, and it would really create a seamless process. So that's kind of Oregon's wish list. And if you have any questions specifically for us at the end, please feel free to ask.
Great. Thanks so much, Carrie. We really appreciate the perspective from the states, and also have been really appreciative of both you and Sarah's willingness to share information and share kind of what your challenges are, because I think that's the best way we'll all learn. So I think we're now going to hear from Heather. Are you on, or is Representative Bass joined us yet?
I am on. She has a bill they're voting on the floor right now.
Okay. Great.
Hoping the voting goes quickly and she can make it back.
Okay. So wonderful. So we'll start. We're really happy to have you, Heather Zanoni, who's the Senior Policy Advisor for Child Welfare Policy for Congress member Karen Bass. Karen Bass is in her 4th term and represents the 37th Congressional District in California. Representative Bass continues to hold many leadership positions in Congress in many areas of policymaking. She's maintained a focus on reforming our nation's foster care system and giving voice to youth. She created the bipartisan Congressional Foster Youth Caucus along with co-chair Representative Tom Marino from Pennsylvania. The caucus has kept the issue of foster care reform on the national agenda and has provided leadership in the areas of legislative reform. We're grateful for her national leadership in all these areas related to foster care, including health care coverage. So we're thrilled to have you, Heather, talking about efforts for reform to fix some of these issues around Medicaid to 26.
Well, thank you very much. I really appreciate it. And I apologize. I'm sure my boss would send her apologies for not being present. She absolutely intended to. But I appreciate the chance to talk about this, because it's dear to her heart. It's very dear to my heart. And I think Cody really did a great job of demonstrating how critical healthcare is to becoming independent adults, and particularly when youth move to another state. When you leave the state that you were in foster care, you put more distance between your social and your community networks, and you do that in exchange for opportunities in other states. That healthcare link is essential. Cody's was an acute problem, but I think what we see in foster care really is that a lot of foster youth have chronic conditions. It's about 80% of foster youth have chronic conditions like asthma and diabetes, and about 25% have 3 or more chronic conditions. So again, the healthcare, not just for acute cases that can really disrupt your life, but also for chronic conditions. As people have already pointed out, it should have been a really straightforward provision of Obamacare. Young adults who were in foster care and enrolled in Medicaid at the age of 18 or older in states that extend foster care should have had Medicaid until they turned 26. It should have been pretty straightforward, but as people already pointed out, that the Department of Health and Human Services, when they released their regulations, they gave states the option of covering young adults, and so coverage then varied by states. But it was really never supposed to be optional, and the congressional record is super clear that Medicaid was supposed to cover all young adults who were enrolled in Medicaid and who were in foster care at age 18, even if they moved to a different state. The problem was the language in the law wasn't very clear. So to fix this, Rep. Bass introduced H.R. 4998, the Health Insurance for Former Foster Youth Act. The bill does 2 things. First, it fixes HHS's interpretation of the ACA that resulted in restrictions on health care portability for fosters and former fosters. And then second, it requires foster care agencies to reach out to eligible youth to inform them that they're eligible for Medicaid. So we're trying to fix 2 of the prongs of the strategy that FosterClub is working on. FosterClub and everybody else are working on. So to be very clear, though, the bill applies to youth who continue in foster care after the age of 18 and up to the age allowed by the state. It also applies to former fosters who were in care at the age of 18 and enrolled in Medicaid up until the age of 26. And then third, it covers foster youth who were in care at the age of 14, but then exited to a kinship guardianship placement. So even if your kinship family wasn't receiving kinship guardianship payments, you're still eligible as long as you were in foster care after the age of 14. So we expanded and hopefully we'll be covering. We won't be having people choose between foster care and kinship care because of the long-term benefit, because there might be better long-term benefits on one side than the other. What else? Oh, and I think I did say again that the bill requires foster agencies to reach out to eligible youth. So, and then the other thing I wanted to point out is recently in the budget caps bill, or I don't even know how else to even call it this because we call it the budget caps bill. But at any rate, the Family First Law was passed in February. And in that, there's a requirement that a document should be given to former fosters and fosters to demonstrate that they're categorically eligible for Medicaid without having to meet the income requirements of Medicaid. So where states are providing the documents providing foster youth with the documents that they need to transition out of foster care, there should also be this proof of foster care in those documents. And that provision is effective as of the date of the law, which was February 2nd, 2018. So it takes time to roll stuff out, but it's effective now. And I think one of the things that, we've said that HR 4998 is about making sure that foster youth have health insurance as they transition to adulthood. But the way my boss sees this is really about fundamental fairness. It's about treating fosters the same way that we treat all young people, because non-fosters are able to stay on their parents' health insurance to the age of 26, even if the youth doesn't live in the same state as their parent. It really is just basic fairness. So we want to thank Cody for sharing his experience. We're just really proud of you. It's kind of amazing what you've achieved. And we want to thank FosterClub and Celeste for helping to raise awareness to fix the problem. Thank you to everybody who's participating on the webinar. And if you have questions about the bill, you can contact Ms. Bass's office, ask for Heather Z, and I can answer your questions.
Great. Thanks so much, Heather. And we look forward to helping show support for the bill and provide any support that you all need to move the bill forward, because we agree with you that it is an issue of equity, and it also is just makes so much sense to make this so a youth knows wherever they go in the United States that they have this guarantee of healthcare, and it won't hold them back and create more barriers as they move on and enter adulthood. So thanks so much, and we appreciate you working with us on this issue and on this campaign. So we'd love to open it up to questions. What we're really interested in hearing from you all is, Sarah and Carrie really showed, Nebraska and Oregon have already jumped in to this work, as many of you guys who are on the phone have done. And what we hope the campaign will offer you is an opportunity to enhance the advocacy and work you're doing, so that we can provide you that support, but also you can use it as an opportunity to get more of the stakeholders in your community on board. So we'd love to hear whether it's questions you have or work you're doing that you want to share, as well as interests you have in doing work. When you look at the 7 issues, are there particular issues that you're really interested focusing on in your state or your community in the next year? We would love to hear from you because it will help us figure out areas to prioritize, but also different resources to help everyone out with. So we're hoping people will join in, and I guess I would invite Carrie and Sarah, if you, I think both of you did mention, what you're working on, but I don't know if you want to share a little more. You guys have been, part of this work even before the campaign, but are there any particular areas you really hope that you can use the campaign to get more attention and focus on these issues in your state? So you could just provide an example of maybe how you're thinking about really leveraging the campaign to your advantage in your state.
Well, this is Carrie, and I think one of the biggest things that I really kind of focused on is the application process. And I love the idea that I believe it's the state of California has the one-page application, and that it's very it's simplified. And I think if we could have just a consistent, simplified application process, that would certainly help. And then also the other piece that I think, again, is a resource that we don't always, people don't always know about, and I would love to see state, in every state, is that having those trained application assisters that we have through FosterClub here in Oregon. So that has been a huge help because they've actually been trained on the application and Oregon Health Plan, and do a great job as far as assisting our youth and our young people with filling out that application and realizing that they are, eligible for healthcare with that.
And I'm glad you raised that issue. I mean, I think one of the things we can really share with the whole group is several of the states do have one-page foster youth specific applications. California is one, but there's a couple of other states. And if that's something you are interested in your state, we're happy to share that with you. And so you can talk with California and other peers to see how a one-page application might work. We also have a couple of other examples of states who have, through their technology, condensed their application. And I'm sorry that I'm not the greatest technological person, but for most of your states, your Medicaid application is electronic in most cases, and might be combined with other applications for public benefits, so that when you raise this issue of simplifying it for youth who might fall into this category, it is complicated, and we want to acknowledge that because it might be part of a larger application, but that through technology and through I think a lot of hard work in terms of computerizing these applications, that there are ways to streamline it so that you could ask a question that if a youth does identify themselves as a former foster youth, that then it would the application would jump to the questions that they need to answer and not put them through the process of answering questions, for example, related to income, that they don't need to answer and aren't necessary for eligibility. And as we know, the more questions that you have and the longer the application is, you really do raise an issue of potentially presenting more barriers, because a question might, a young person may not have the answer to it and may stop the application, or may not have the assistance to know how to answer questions. So I think, Carrie, the idea of assisters and really enlisting them is so important. But if we can make the application as streamlined as possible, that is a way that I think we really do enhance the capacity and really for youth to have access. So we do have a couple of examples of states who, again, I can't speak to exactly the way the technology works, but who we can, I think, then connect peers with to figure out how do you pitch this to your state. How are these ways to streamline? So the one pager is one way, but also looking at your technology to see if there's a way that you can reduce the 28 pages that a youth would get online to just, the bare bones of questions that need to be answered. Sarah, what about you? I know you're working on a bunch of things. Is there anything that you're prioritizing for this year that you hope the campaign will support you with?
Yes, well, I agree with Carrie that we'd love to see a more simplified application. But one thing that I think we really need to improve, and I'm hoping that the campaign can be helpful with us in Nebraska, is the data tracking. Actually, I think that can be a good first step for states and state-based advocacy. But for us, we have been told we'd be trying to meet annually with our state agency about this provision in particular. And I think that they indicate that they've made some great changes in their process in terms of automatic enrollment and also the renewal issue. But we also annually do a data request, and my colleague Becca Bruni's on the phone, and she's the one that analyzes that data. It's sort of hard to tell from that where we're at in terms of the numbers of young people. And so it's hard for us to tell how well the outreach is working, how well that automatic enrollment process is working. And I think if we had better data, we'd be able to make some improvements if they're needed in Nebraska, and also be a better part of the national conversation about this.
Great. Thanks so much, Sarah. And you guys are doing really great work, and we're happy to have you as a state and a partner that we can really spotlight and share information with other states. So we appreciate that. Heather, we did get some questions about what partners on the phone can do to help advance the bill. Are there specific things, either with gathering information or talking with representatives, that you would request that we do, things that would help you and Representative Bass in moving this bill forward?
I think Heather.
Jenny,
go ahead, Celeste.
Just encourage folks. I think a couple things is one thing that the campaign will be doing is recruiting young people's stories. So if those on the line work with young people or know of stories and are able to connect them to FosterClub, we are going to be working, the campaign will be working to develop a clearinghouse of young people's story, because, as Cody so well illustrated, those types of stories are some of the most compelling to provide to policymakers. Other than that, I think one thing that people could do is also to log on to Member Bass's website and take a look at the legislation and see who the sponsors are at this point. And I would encourage calls to members of representatives to ask them to sign on to sponsor the legislation.
Great, thanks so much. And we'll be through the campaign asking you guys if there is a need for support and different activities you can do. We've done some letters of support, but probably we'll need to do more of that, get stories, and really, as Celeste said, show what the impact of this would be for young people and what the harms that occur when we don't have this type of coverage. So we really do, we're glad everyone's interested in this and that we could reach out to everyone to enlist your support. And then one of the areas that we really highlighted for the campaign is about outreach. I think we've all noted, and Shannon has noted, who's done a lot of the heavy lifting on doing the 50-state survey, that while many of us are telling young people and stakeholders that we work with about this provision, there's a lot of work to be done on outreach, both to young people and other stakeholders. Celeste, and I know Carrie, you've been doing a lot of outreach too. Can you just share a little bit about how outreach and FosterClub developing some memes and other very youth engaging strategies for outreach, how that will what kind of efforts they'll be in the coming months, and because many of us really want to do more outreach but may not have the technical capacity and the creativity, but you guys do, FosterClub does. So can you tell us a little bit about the outreach components?
Sure, absolutely. So a couple things. One thing we learned quite quickly, actually, after the former foster youth provision passed. What we found out is that one of the challenges to engaging young people in conversations about healthcare is that young people think they're invincible and don't imagine that they'll need healthcare. And so that was one of the sort of challenges that we saw right off the bat. The other piece that we saw is that during the transition period, young people are getting peppered with all sorts of information about how to access resources and things they need to take care of as they transition to adulthood. And healthcare wasn't always at the top of the list. Housing, getting into school, those types of things often were sort of the focus areas. One of the approaches FosterClub took, starting a little over a year ago, is we developed a series of social media memes and other sort of shareable social media content. And we sort of took two approaches to that. One is to feature the stories of other young people. We find that people like Cody, who can talk to their peers, are really great messengers to talk about healthcare and to encourage their peers to sign up and better understand it. I mean, shoot, I think Cody could give us all a lesson about how to navigate the bureaucracy surrounding healthcare. So somebody like Cody, who's a peer, who's been in their shoes, that's one really strong strategy. The other strategy that we've taken is to create an edgy campaign nicknamed Crap Happens with, the hashtag and question mark and number sign all at the beginning of the sign. So it's a bit of an edgy campaign, and it features sort of hilarious pictures of people having bad accidents, like flipping over the handlebars of bicycles and things like that. And the idea of that campaign is to remind young people that unexpected things can happen and sort of derail your best laid plans, and that it's important to get this in order when you can. And sort of using some humor and using social media to prompt young people into making sure that they're covered with healthcare. We will be packaging these types of tools into a communication toolkit that will be freely available for states, advocates, foster parents, agencies to use in conducting outreach to young people.
Great, thanks so much. And I think that's a great example of what we hope to do with this campaign is produce things that everyone on the call can use in their various states, and produce them in forms that you can either send them out as is, or that you are able to personalize them or individualize them to your state or jurisdiction. And so that also means we want to hear from you of what would be helpful. And so we're looking forward to having those discussions in the coming months. And we really appreciate everyone being on the call. Thank you so much to our panelists. We had a great panel, and we're so sorry we made them all speak very quickly to fit into the time, but you have their contact information, and they're definitely great resources. Again, we're really excited to kick off this campaign and have you all be part of the campaign, and we will be sending out more information to see very concrete ways that you can join in and both join in to support the campaign, but also to figure out ways that you can let us know what support you need to make this campaign a reality in your state or jurisdiction. So again, thank you so much. If there are additional questions that we didn't get to, we will work hard to get get back to you to answer those, but we thank you so much for joining us today. Shannon or Celeste, any final parting words?
I would just add that there's a handout attached to the webinar, and we will save the recording and try to set it out and watch for an online website that will be launched, and we'll try to put a link to that or some information about that and what we send out to everybody who attended. Thank you for spending time with us.
Thanks, everyone.